Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Losartan. Its brand name is Cozaar. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So Losartan is classified as an angiotensin receptor blocker, or an ARB. It blocks the vasoconstrictor and aldosterone-secreting effects of angiotensin II by selectively blocking the binding of angiotensin II. In terms of indications for use, we often see this medication used in the treatment of hypertension or high blood pressure. We see it used prophylactically to prevent a cerebrovascular accident in hypertensive patients with left ventricular hypertrophy. And we also may see it used to treat diabetic nephropathy in patients who have a history of hypertension who also have type 2 diabetes. Now, before somebody was to use Losartan, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication will be contraindicated in patients who have a hypersensitivity to Losartan or any other component of the formulation. And this medication will be contraindicated to be used alongside of aliskiren in diabetic patients. Now, in terms of precautions, sometimes symptomatic hypotension or low blood pressure may occur in volume or salt-depleted patients. We would want to avoid using this medication with other renin-angiotensin system inhibitors. Hyperkalemia, or an increase in potassium levels, has occurred using this medication, and patients would be at more of a risk of experiencing this if they were also using other medications that may increase potassium. Sometimes this medication may have to be stopped temporarily until potassium levels go back to normal. Sometimes while using Losartan, renal or kidney function may deteriorate and could sometimes lead to acute renal failure. Once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Losartan, they can expect to receive their dose orally. Now, if somebody is using this medication to treat hypertension or high blood pressure, they would typically start off with a dose of 50 milligrams once daily, and they may increase this dose to a max of 100 milligrams per day, which can be taken as one dose or in two divided doses. In heart failure, we may see 25 to 50 milligrams taken once daily, and this dose in this setting may be increased all the way up to 150 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Losartan, so I'll go over some of those here now. 2% of patients using this medication for high blood pressure may experience a backache, and 3% may experience dizziness. Some patients may experience a cough or nasal congestion, and up to 8% may experience an upper respiratory infection. Some more rare but serious side effects would be syncope or fainting, angioedema, anaphylaxis, a cerebrovascular accident, or acute renal failure. That's all we're going to talk about today with Losartan. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.